Every day, millions of people swallow this tiny white tablet without giving it a second thought. It relieves pain, reduces fever, and is found in almost every home. But have you ever wondered how this tiny tablet actually works inside your body? By the end of this lecture, you'll know exactly how this tiny tablet works inside your body. You'll discover why it reduces fever, relieves pain, and how it can even damage the liver. And most importantly, you'll learn how doctors save lives after a paracetamol overdose. After this lecture, you'll be able to answer questions like, how does paracetamol reduce fever? Why doesn't it cure infections? What happens during an overdose?
And why is N-Acetylcysteine considered the life-saving antidote? Let's find out.
Paracetamol is also known as acetaminophen. It is one of the safest medicines when taken in the correct dose. But this medicine can become life-threatening if it is taken incorrectly. Doctors recommend paracetamol mainly for pain and fever. It is not an antibiotic, and it does not cure the infection causing the fever. So what exactly does paracetamol do? It works mainly inside the brain, where it changes the way your body senses pain and controls temperature. To understand this medicine, we first need to follow its incredible journey. From your mouth to your brain. Every organ plays a role. The stomach, the intestine, the liver, and finally the brain. And every movement follows human physiology. Nothing happens by chance. In the next chapter, we'll travel inside your body to discover exactly how one tiny tablet changes pain and fever. Your journey begins the moment you swallow a paracetamol tablet with water. The tablet passes through the esophagus using rhythmic muscle contractions called peristalsis. Within seconds, it reaches the stomach. Inside the stomach, the tablet begins to break apart. However, only a small amount of paracetamol is absorbed here. The real absorption happens in the small intestine. The small intestine has millions of tiny finger-like projections called villi. These structures greatly increase the surface area for drug absorption. Most of the medicine enters your bloodstream here.
From the intestine, the medicine enters the portal vein. This special blood vessel carries absorbed substances directly to the liver. The liver is the body's chemical processing factory.
In the liver, most paracetamol is safely processed. Special enzymes prepare the drug for safe elimination later. Only a tiny amount becomes a toxic compound.
Normally, this toxic compound is quickly neutralized. A powerful antioxidant called glutathione protects your liver. This protection is essential for safe use.
After leaving the liver, paracetamol enters the general bloodstream. Now it travels throughout the entire body. Every heartbeat carries the medicine farther. Unlike many medicines, paracetamol easily reaches the brain. It crosses the blood-brain barrier. This is where its main action begins.
Inside the brain, the medicine reaches pain processing centers. It also reaches the hypothalamus. This tiny region controls body temperature.
When infection causes fever, your brain raises the body's temperature set point. Paracetamol helps return it toward normal.
It also reduces the sensation of pain. This is why headaches and muscle pain improve. But it does not remove the cause of the disease.
After doing its job, the medicine returns to the bloodstream. The kidneys prepare to remove it. Most metabolites leave the body in urine. This usually happens within several hours. Very little active medicine remains. A normal dose follows this safe journey. But overdose overwhelms the liver. That is when serious damage begins. In the next chapter, we'll uncover the exact molecular mechanism behind pain relief and fever reduction. You'll finally understand how one small tablet changes the way your brain feels pain. To understand paracetamol, we must first understand how pain begins. Special pain receptors called nociceptors detect harmful stimuli. These receptors immediately send electrical signals toward the spinal cord. From the spinal cord, pain signals travel upward to the brain.
The thalamus acts as the brain's relay station. Finally, the cerebral cortex recognizes the sensation as pain.
But pain signals need chemical messengers to become stronger. One of the most important messengers is prostaglandin. Prostaglandins make pain-sensitive nerves even more sensitive. So where do prostaglandins come from? They are produced by enzymes called cyclooxygenase, or CoX enzymes. These enzymes are essential for prostaglandin production.
Now paracetamol enters the brain. It acts mainly inside the central nervous system.
Unlike many painkillers, its main target is the brain, not inflamed tissues. Inside the brain, paracetamol reduces CoX enzyme activity. This decreases prostaglandin production. Less prostaglandin means weaker pain signaling. The brain now receives fewer pain messages. The intensity of pain gradually decreases.
This is how headaches and body aches improve. Paracetamol also acts on the hypothalamus. The hypothalamus is the body's thermostat. It constantly regulates body temperature.
During infection, immune cells release pyrogens. These pyrogens stimulate prostaglandin production in the brain.
The thermostat is reset to a higher temperature. Paracetamol blocks this rise in prostaglandins. The thermostat returns toward normal. The fever slowly comes down. Your body now begins losing excess heat.
Blood vessels widen to release heat. Sweating further cools the body. One question remains. Why isn't paracetamol a strong anti-inflammatory medicine? The answer lies in where it works best. Inflamed tissues contain large amounts of peroxides. These reduce paracetamol's ability to block CoX enzymes.
So inflammation is only minimally affected. That is why medicines like ibuprofen reduce inflammation more effectively.
But paracetamol remains one of the safest choices for pain and fever, when used at the correct dose. But what happens if too much paracetamol is taken? A life-saving medicine can become a deadly poison. In the final chapter, we'll explore overdose, liver toxicity, antidote with N-Acetylcysteine, safe dosing, and the clinical use of paracetamol in emergency medicine. So far, paracetamol has protected the body, but every medicine has a safe limit. When the recommended dose is exceeded, the liver faces a dangerous challenge. The same medicine that relieves pain can become life-threatening. In adults, the maximum recommended dose is generally 4 grams per day. Many doctors recommend staying below 3 grams daily, especially for older adults or those at higher risk. Children require weight-based dosing, usually 10 to 15 milligrams per kilogram per dose, not exceeding recommended daily limits. Inside the liver, about 90% of paracetamol is safely metabolized. It is mainly converted into 3 harmless compounds. These are paracetamol glucuronide, paracetamol sulfate, and mercapturic acid, by glucuronidation and sulfation. These harmless metabolites are later removed by the kidneys. But around 5 to 10% follows another pathway. This pathway uses the liver enzyme CYP2E1. It produces a highly toxic metabolite called NAPQI. Normally, NAPQI is immediately neutralized.
Inside the body, specialized molecules work to protect us from harm. Glutathione binds to the toxin and makes it harmless. The liver remains healthy.
In overdose, glutathione stores become exhausted. NAPQI begins to accumulate. The toxin attacks hepatocytes directly. Liver cells begin to die. This condition is called hepatic necrosis. Without treatment, acute liver failure may develop. Symptoms do not always appear immediately. During the first 24 hours, nausea, vomiting, sweating, and abdominal discomfort are common. Between 24 and 72 hours, liver injury becomes more severe. Pain develops in the right upper abdomen. After 3 to 5 days, acute liver failure may occur. Without urgent treatment, multiple organs may fail. Fortunately, an antidote exists. It is called N-Acetylcysteine, or NAC. NAC restores glutathione inside liver cells. The earlier NAC is started, the better the outcome. It works best within 8 hours of overdose, but patients can still benefit even if treatment begins later. In hospitals, doctors measure blood paracetamol levels. The Rumack Nomogram helps determine treatment after a single acute overdose.
It guides the decision to start NAC. When used correctly, paracetamol remains one of the safest medicines. It is widely used for fever, headache, muscle pain, dental pain, and postoperative pain. It is listed among the world's essential medicines.
Paracetamol teaches us an important lesson. The right dose heals, the wrong dose can harm. Always follow the recommended dose. Read combination medicines carefully. Seek immediate help if an overdose is suspected. Knowledge saves lives.